Gentlemen, let's be honest for a moment. You probably wouldn't bring this up at the gym, not in the locker room, maybe not even with your closest friend. But that thought has been there quietly, persistently, maybe for decades. Am I normal? You're not alone. Today, we're going to tackle one of the most common yet unspoken questions in men's health: penis size. Hi, I'm Dr. Jocelyn, a board-certified urologist with 5 years of experience helping men regain confidence, intimacy, and peace of mind. And today, we're going to separate myth from science, fantasy from biology, insecurity from truth, because millions of men silently carry doubts that were never theirs to begin with. Before we dive in, do me a quick favor. Drop a comment and tell me where you're watching from. I love seeing men from around the world connect on these topics. Hit the like button if you've ever wondered about this subject. And of course, subscribe to my channel. Every week, I share science-backed answers to the questions men are often too embarrassed to ask. Here's the truth that might surprise you. More than 90% of men are completely normal. A landmark global study of over 15,000 men, published in the British Journal of Urology International, found that most men fall squarely within a healthy average range. Yet, so many still feel inadequate. Why? Think back to when you were 13 or 14, stumbling across your first adult video. You didn't see biology, you saw performance. The actors weren't chosen at random. They were cast for size, shot with special angles, enhanced with lighting, sometimes digitally edited. Combine that with locker room chatter, crude jokes, and cultural stereotypes, and suddenly, a perfectly normal body starts to feel like not enough. Studies show up to 60% of men feel some dissatisfaction with their size, even though 95% of them are medically normal. And here's another reality check. When women are surveyed, only 5 to 10% say size is very important in a partner. Most say connection, confidence, and intimacy matter far more. The problem isn't biology, it's perception. And perception, gentlemen, can be changed. Now, let me step into my role as your doctor for a moment. In my 5 years as a practicing urologist, I've spoken with thousands of men from their 20s to their 70s and beyond. And here's what I can say with absolute certainty. Men almost always underestimate themselves. Women almost always care less than men imagine. Biology almost always lands you in the normal range. Yet, here's the catch. Most men never learn how to measure correctly. They use bathroom mirrors, inconsistent methods, or compare themselves in the worst possible conditions. That's like stepping on a broken scale and believing the number is real. No wonder anxiety builds. Today, I'll teach you the step-by-step method doctors use in clinical research. After this, you'll know how to measure accurately. No more guessing, no more distorted comparisons. But before we get into the how, let's look at some actual numbers. You might be surprised. Erect length, 13.2 cm, approximately 5.2 inches. Erect girth, 11.5 cm, approximately 4.5 inches. Range for 90 to 95% of men, 10 to 16 cm length, 4 to 6.3 inches. If you fall within this range, you are perfectly normal. Yet, most men compare themselves to Hollywood, adult films, or exaggerated locker room stories, and their brains are tricked into insecurity. Now, let's go through the 5 most common mistakes men make about size and how to fix them. Mistake number 1, measuring the wrong way. Most men measure from the skin, half aroused, or when cold. The correct medical method: stand upright. Use a ruler or soft tape. Place it on top of the penis, pressing gently into the pubic bone, not just the skin. Flaccid. Stretch it gently to full natural length and measure from base to tip. This is flaccid stretched length, which predicts true erect length. For girth, wrap a soft tape around the thickest part of the shaft. First-time measurements usually reveal you're longer than you thought. Mistake number 2, believing fantasy instead of science. The 2015 study of 15,000 men showed average erect length, 13.2 cm, average erect girth, 11.5 cm. If you're anywhere in this range, you're medically normal. Hollywood and media, not biology, they're illusions. Mistake number 3, ignoring body fat's role. Belly fat can make the penis appear shorter, but it doesn't shrink, it retreats into the fat pad above the pubic bone. Losing just 2 inches off your waist can reveal up to 1.5 cm, half an inch, of visible length. No surgery, just healthy lifestyle changes. Mistake number 4, forgetting blood flow is everything. The penis is a vascular organ, not a muscle. Better circulation equals fuller erections and more visible size. Eat nitrate-rich foods, beets, spinach, arugula. Stay hydrated, quit smoking. Try supplements like L-citrulline or L-arginine under medical guidance. Perform pelvic floor exercises, Kegels for men. Mistake number 5, comparing instead of connecting. Intimacy isn't a scoreboard. Women remember connection, confidence, and presence, not centimeters. Men who are present, affectionate, and secure always outshine men who are anxious, regardless of size. Here's your doctor-approved, step-by-step plan. Measure correctly. Use the flaccid stretch method and tape for girth. Write down your results, it's your truth. Improve visibility. Trim waist fat. Even small reductions make a noticeable difference. Optimize blood flow daily. Eat greens, hydrate, walk, and strengthen pelvic floor muscles. Check hormones. Low testosterone can affect size, performance, and confidence. Natural improvements include sleep, strength training, and nutrition. Focus on connection, not comparison. Prioritize intimacy, presence, and emotional closeness over numbers. Small, intentional actions change perception and confidence faster than any surgery or procedure. If you've carried this insecurity for years, maybe since your teens, here's what I want you to hear clearly. You are not broken. You are not too small. You are already enough. Many men who seek surgery or risky procedures are already medically normal, and dissatisfaction often persists afterward because the issue wasn't biology, it was perception. I've seen men in their 70s rediscover confidence after understanding the truth. Their relationships improved, their intimacy deepened, not because their bodies changed, but because their mindset did. When you stop obsessing over size, you free yourself to focus on what really matters: health, confidence, and meaningful connection. Gentlemen, let me leave you with this thought. You are not your measurement, you are your mindset. Ask yourself, what's more powerful? Being half an inch above average on a chart, or being a man who is confident, present, and in control of his health and life? The answer is obvious. Focus on connection, on your health, and on being a man who shows up for himself and his partner with confidence. If you found even one truth in this video that eased your mind, like this video, subscribe to my channel for weekly science-backed men's health insights. Share this with a friend who could benefit from knowing the truth. And here's your action step. Leave a comment anonymously if you like, and tell me your biggest challenge with confidence or intimacy. I'm Dr. Jocelyn, reminding you, you are not too old, not too small. You were simply never told the truth. Now you know. Take this knowledge, measure accurately, optimize your health, and step into confidence and connection like the man you are. I'll see you in the next video.